Hello everyone and welcome to this new course on the urinary system. As a disclaimer, this course and all the associated materials are provided for educational and informational purposes only. There's no guarantee of accuracy, while every effort is made to ensure the information is correct and current. Not a practical guide, this material is not intended to serve as a manual for clinical practice by any means, or medical diagnosis or treatment, and you should still go for a professional consultation. So users are strongly encouraged to consult official medical guidelines and seek the advice of a qualified healthcare professional before making any clinical decisions or taking any action based on the information provided herein. One, introduction to the urinary system. This is a vital organ system responsible for maintaining the internal environment or homeostasis of the human body. Its primary role is to regulate fluid balance, remove metabolic waste products, and maintain electrolyte concentrations. Regulate blood pressure also, and contribute to acid-base homeostasis. The urinary system works closely with the cardiovascular, endocrine, respiratory, and nervous system to ensure physiological stability, also known as homeostasis. Homeostasis, by the way, is the body's ability to maintain a stable, constant internal environment despite changes in the outside ambience or the outside world. It involves a continuous balancing act where systems like kidneys and hormones adjust levels of temperature, water, and chemistry in order to keep them within a healthy range. The organs of the urinary system include kidneys, ureteres, urinary bladder also, and urethra, urethra, which is the bottom interface that ejects the fluids outside of the body. Concerning the notion of maintaining electrolyte concentrations, what is an electrolyte anyway? An electrolyte is a substance that breaks down into ions or charged particles, charged substance, that are electrical, They become electrically charged when dissolved in water or body fluids like blood. These charged particles are essential for virtually electric functions within the body, such as fluid balance, controlling the movement of water in and out of the body, of your cells, osmosis, nerve signaling. They enable the electrical impulses to travel from the brain into different organs to talk to your body. Muscle contraction. Electrolytes like calcium and potassium are required for your muscles to tighten and relax. And pH balance. They help keep your blood's acidity levels within a very narrow, healthy range. In this sketch, we look at the anatomy of the urinary system. So you have the kidneys with the renal cortex on the outside, the medulla or renal medulla, which is the knots or knotted like cavities. Here within you have the renal pelvis, the distrusor muscle, etc. Urethra down below, the bladder, urinary bladder, ureter at 4, etc. Functions of the urinary system. The urinary system performs several essential physiological functions. First, you have excretion of metabolic waste. Cells continuously produce waste products during metabolism. These substances can become toxic if they accumulate and if the body doesn't get rid of them. The kidneys remove wastes such as urea. Now urea, it is the primary nitrogenous waste product formed in the liver from the breakdown of proteins. It is highly soluble in water, making it easy for the kidneys to filter it out of the blood and flush it away. Creatinine, the second one, it is a byproduct of muscle metabolism, the breakdown of creatine phosphate. It is produced at a relatively constant rate because the kidneys filter it almost entirely without reabsorbing it. Blood levels of creatinine are a key indicator of how well your kidneys are functioning. Third, uric acid. This is created when the body breaks down purines, found in certain foods and body tissues. While most of it is dissolved in blood and excreted by the kidneys, high levels can lead to formation of crystals causing things like kidney stones. And finally, drugs and toxins. The kidneys are essential for clearing many medications and environmental toxins from the bloodstream. They filter these substances or their metabolites into the urine to prevent toxic buildup in the body's tissues. Regulation of water balance. The kidneys regulate the amount of water retained or eliminated by the body. Clinical importance. Excess water loss leads to dehydration. That's one. Second, excess water retention may cause edema. Edema is the bloating of tissues and muscles, like you would see someone's legs have become cylindrical almost. This is because of an over retention of the water. That would be an indicator of a dysfunction in the kidneys. The hormone, anti-diuretic hormone ADH, helps regulating water reabsorption. Before talking about ADH, let's at first define nephrons. Nephrons are the structural and functional units of the kidneys. Each human kidney contains approximately 1 million of these microscopic filtering devices or structures, which are vital for maintaining the body's internal balance. They work through a multi-step process to cleanse the blood and create urine. First, filtration. Blood enters the glomerulus, which is a cluster of tiny blood vessels where water and small waste molecules are forced into a cup-shaped receptor or structure called Bowman's capsule. Then, reabsorption and secretion. So, the resulting fluid travels through a long winding renal tubule. Along the way, the body reabsorbs essential nutrients like glucose and amino acids and most of the water back into the bloodstream while secreting additional waste into the tubule. Finally, excretion, the final concentrated fluid, now called urine, is collected and sent to the bladder for disposal. ADH, or antidiuretic hormone. ADH is produced and synthesized by specialized nerve cells within the hypothalamus. The hypothalamus is the upper part of the brain stem. Storage and secretion. It is transported down nerve fibers and stored in the posterior pituitary gland below the hypothalamus, which releases it into the blood when triggered. Now, the trigger of release is a high concentration of blood osmolarity, in other words, a high concentration of salts and solutes, okay, or a significant drop in blood. ADH primarily targets the distal convoluted tubules and collecting ducts in the nephrons in the kidney. Okay, ADH now binds to specific receptors. They are called V2 receptors on the surface of the cells lining these ducts. Water channels. This binding triggers the insertion of specialized water channels proteins, okay, called aquaporins, into the cell membranes. These channels act like doorways or gates, allowing water to pass from the forming urine back into the bloodstream. Electrolyte balance. Electrolytes are minerals that are electrically charged. They carry electrical charges. They are essential for fluid regulation through osmosis, cellular osmosis, carrying electrical signals from the nerves into organs, regulation of heartbeat, cardiac function, and muscle contraction. Important electrolytes regulated by the kidneys include sodium, Na+, potassium, K+, calcium, Ca2+, and chloride. Acid-base balance. The kidneys maintain blood pH, which is the measurement of acidity versus alkaline level, within the normal range, 7.35 to 7.45, almost a neutral state. They achieve this by excreting hydrogen ions, H+, which increase the acidity level, by the way, and reabsorbing bicarbonate ions, HCO3-, to render it more alkaline, to reduce the acidity. Failure of this regulation can lead to acidosis or elevation of the acidity level in the blood, or alkalosis, that would be the exact opposite. The reduction, okay, into a more basic level beyond or above the neutral level, because a pH above would be alkaline, a pH below would be acidic. Blood pressure regulation. The kidneys help regulate blood pressure through the RAS, or renin, angiotensin aldosterone system. RAS system. When blood pressure decreases, kidneys release renin, that would be the first stage. Then renin activates angiotensin, which in its turn leads to vasoconstriction or the constriction of blood vessels. And also at the same time, sodium and water retention increases. This in its consequence, okay, as a result for that, it raises the blood pressure. Now let's go a little bit step by step. So again, the renin, angiotensin, aldosterone system is a complex hormonal cascade that regulates long-term blood pressure, blood volume, and electrolyte balance, the balance of charged particles that trigger muscle contraction, fluid balance, etc. It acts primarily as a compensatory mechanism to elevate blood pressure when it falls too low. Now the RAS cascade steps. First, the trigger within the kidneys when blood pressure or volume drops or sodium levels decrease. Specialized juxtaglomerular or JG cells in the kidneys release an enzyme called renin into the bloodstream. Now, within the bloodstream, that's the first conversion. The liver constantly produces an inactive protein called angiotensinogen. Okay? Tensinogen. Renin acts on this protein, cleaving to it into angiotensin 1. The second conversion within the lungs or kidneys, angiotensin 1 is relatively inactive. As it passes through the lungs and kidneys, it becomes angiotensin 2 by the angiotensin converting enzyme or ACE. Effector actions, angiotensin 2 triggers several critical responses to raise blood pressure. First of all, as we mentioned, vasoconstriction, constriction of the blood vessels, narrowing the cross-sectional area, which immediately increases systemic vascular resistance and blood pressure. Aldosterone release, it stimulates the adrenal glands, which sit on top of the kidneys, to release aldosterone hormone, which prompts the kidneys to reabsorb sodium and water back into the blood while excreting potassium. This in its turn would elevate the blood pressure. ADH and thirst, it triggers the release of antidiuretic hormone ADH from the pituitary glands to retain more water and stimulates the brain's thirst mechanisms. By the way, the potassium ion, which is the K+, should be released from the blood since this substance has an inhibitory effect on the heart rate. So in order to elevate the blood pressure, the body needs to reabsorb sodium Na+, which increases the heart rate, and get rid of the K+, because potassium has the exact opposite effect, which is reducing the heart rhythm. This eventually will restore homeostasis by increasing blood pressure and regulating the electrolyte balance within the body. The kidneys produce important hormones such as the EPO or erythropoietin and calcitriol. Now, erythropoietin or EPO. EPO is the body's primary regulator of red blood cells or RBC production. When specialized cells in the kidneys detect low oxygen levels in the blood, which is hypoxia in other words, they ramp up EPO production. The EPO travels through the bloodstream to the bone marrow. It stimulates the stem cells in the marrow to divide and to mature into new blood cells, red blood cells. So more red blood cells can carry more oxygen. This would regulate the oxygen level and restore balance eventually. For the calcitriol, which is the active version of vitamin D, your skin makes vitamin D from sunlight or you get it from food. Both works. And the liver modifies it first, so the kidneys then use an enzyme to convert it into calcitriol. Its primary targets are the intestines and bones. Action in the digestive tract, it signals the body to absorb calcium and phosphorus from your food. In the bones, it works with the parathyroid hormone to manage bone remodeling. So it maintains the specific levels of calcium in your blood needed for healthy bones, muscle contraction, and nerve signaling. Homeostasis definition. Again, homeostasis refers to the maintenance of a stable internal environment despite external changes. Examples for that include regulation of temperature, the blood pressure, fluid volume, and electrolyte balance or concentration. Also, this includes acidity levels within the pH metric. The urinary system is one of the most important systems involved in homeostasis regulation. Clinical relevance: loss of homeostasis can result in severe disease. Examples: kidney failure or a malfunction within the kidney, hypertension or higher blood pressure, then electrolyte disorders and metabolic acidosis. Let's talk about the last two. Electrolyte disorders. Electrolytes are minerals that carry an electric charge and help regulate heart rhythms, nerve function, and fluid balance. Common imbalances associated with kidney disease include hyperkalemia or high potassium occurs because reduced kidney function limits potassium excretion, which is dangerous since potassium is inhibitory, so it can lead to a cardiac arrest. It starts actually causing a lowering of the heart rhythm, okay, because again it works on reducing the heart rate, so it affects the heart rhythm, leading to a cardiac arrest. Sodium imbalance may manifest as hyponatremia or too much water diluting sodium, or hypernatremia, too little water concentrating sodium. Okay, so hyper meaning an elevated sodium level, hypo a reduced, excessively reduced sodium level. Phosphorus and calcium. Kidney failure often causes high phosphorus levels, hyperphosphatemia, which can lead to low calcium or hypocalcemia and long-term bone disorders. Symptoms of these imbalances can range from muscle weakness and cramps to confusion, fatigue, and irregular heartbeats. Metabolic acidosis. Metabolic acidosis is a condition where the blood becomes too acidic, characterized by a decrease of bicarbonate, which is a base by the way, that can increase the pH level, reducing acidity, or a buildup of acids. Renal role. Healthy kidneys maintain pH balance by reabsorbing bicarbonate, which can increase pH and reduce acidity, and secreting hydrogen ions H+ into urine. So by getting rid of H+, we can also decrease acidity because H+ are acidic ions. Okay, they can build up acid within the blood. In kidney disease, approximately 30% of patients with advanced chronic kidney disease or CKD develop metabolic acidosis because their kidneys cannot excrete enough acid or produce enough bicarbonate to increase pH level and reduce acidity. Anion gap. This condition is often categorized by the anion gap, which is the difference between positive sodium and negative chloride and bicarbonate charges within the blood, of course. Kidney failure can cause both normal and high anion gap acidosis. Early signs would be fast, deep breathing, air hunger, rapid heartbeat, confusion, and fatigue. Left untreated, chronic acidosis can lead to muscle wasting, bone thinning, osteoporosis, etc. Organs of the urinary system. Kidneys. Location. The kidneys are paired bean-shaped organs located in the posterior abdominal cavity. Okay, of course below in the thigh, not in the chest. Right kidney is slightly lower due to the liver being placed above it. Approximate size 11 by 6 by 3 centimeters. Functions of the kidneys: filtering blood, producing urine, removing toxins, regulate fluid balance, maintain electrolyte balance, regulate blood pressure, producing hormones. Blood supply. The kidneys receive approximately 20 to 25% of cardiac output through the renal arteries. This high blood flow reflects their critical filtration role. This is why they receive as much blood. The ureters. These are muscular tubes that transport urine from the kidneys to the urinary bladder. This is the bladder. The length approximately 25 to 30 centimeters, lined with transitional epithelium. Use peristaltic contractions to move urine. Clinical note: kidney stones may become lodged in the ureters, causing severe pain, hematuria, and urinary obstruction. Hematuria, by the way, is the medical term for blood in the urine. It indicates that the blood is seeping in or leaking into the urinary tract at some point, whether in the ureter, in the bladder, or in the urethra. In such case, it would be starting within the ureter. Of course, it would seep in all the way to the urethra eventually. Urinary bladder. The bladder is a hollow muscular organ responsible for temporary urine storage. Capacity for an average adult is around 400 to 600 milliliters. The bladder wall contains transitional epithelium and the detrusor muscle for contraction. The functionality or function is to store urine and contracting during urination. Urethra. The urethra is the tube that carries urine from the bladder to the exterior. This is the urethra. Male versus female urethra. For the males, it is 20 centimeters, almost 5 times longer than that for the females. The function is also different. It is urinary and reproductive, except for the female, it is only urinary. UTI or urinary transmitted infection, it is lower for the males since it is longer than that for the females. As for the clinical importance, females are more susceptible to urinary tract infections due to the shorter urethra. Formation of urine, basic overview. Urine formation occurs in the kidneys through 3 major processes. First, glomerular filtration, which is the initial dump. This occurs in the glomerulus, a cluster of leaky capillaries. Now, high blood pressure forces water and small solutes out of the blood into the Bowman's capsules, which are cup-like containers. What goes through is water, glucose, amino acids, salts, and nitrogenous waste, but what stays behind and is kept is blood cells, which are larger to fit into these capillaries for the sieve and remain in the bloodstream. This filtrates blood out of the leakage, okay, and blood plasma necessarily, also proteins that need to remain within the body. Second, tubular reabsorption, which keeps the valuable substances. So as the filtrate moves through the renal tubule, the body realizes it just threw away some very important things. So cells lining the tubule use active and passive transport to move essential substances from the filtrate back into the bloodstream. What is reclaimed is 100% of glucose, amino acids, and along with 99% of water and most of the sodium. This leads to the prevention of dehydration and nutrient loss. Tubular secretion, which is the last minute trash removal. This is the reverse of reabsorption and happens primarily in the distal convoluted tubule. The body actively pumps specific substances from the blood into the tubule to be added to the forming urine. What is removed is excess potassium K+, which has an inhibitory effect to reduce the heart rate, but it can dangerously lead to a cardiac arrest. Hydrogen ion H+, which increases the acidity of the blood to manage blood pH, and drugs or toxins. This is the body's final chance to fine-tune blood chemistry and eliminate overflow waste. So going through these again, glomerular filtration, blood is filtered in the glomerulus, water and small solutes pass into the nephron. Tubular reabsorption, useful substances return to the bloodstream such as glucose, water and electrolytes. And finally, tubular secretion, additional waste products are secreted into the tubules. This is the final product that becomes urine. Clinical correlations. Urinary tract infection or UTI, a bacterial infection affecting urethra, which is the bottom low part of the urinary system, the bladder, and kidneys. Symptoms: burning urination, frequent urination, and fever. Another case is kidney failure, which occurs when kidneys lose filtration ability. Consequences include fluid overload, so an excess amount of fluid, electrolyte imbalance, which is necessary for transmitting the electrical impulse of the nervous system, controlling the fluid volume, water volume also, and the heart contraction, And toxin accumulation. Severe cases require dialysis, which is the artificial removal of the urine from the bloodstream. Finally, the urinary system is essential for survival and maintenance of the internal physiological balance. The kidneys perform the majority of urinary functions through filtration, reabsorption, and secretion. Understanding the anatomy and physiology of the urinary system provides the foundation for studying renal diseases, pharmacology, fluid therapy, and clinical medicine. Second, anatomy of the kidneys. The kidneys are highly specialized organs responsible for blood filtration, waste removal, and regulation of body fluids, and endocrine functions. Understanding renal anatomy is fundamental for interpreting renal physiology and pathology. Each kidney contains approximately 1 million functional filtration units called nephrons. A reminder, nephrons are the structural and functional units of the kidneys. Each human kidney contains approximately 1 million of these microscopic filtering structures. They work through a multi-step process to cleanse the blood and create urine. First, filtration. Blood enters the glomerulus, a cluster of tiny blood vessels where water and small waste molecules are forced into a cup-shaped structure called Bowman's capsule. Reabsorption and secretion. The resulting fluid travels through a long winding renal tube. Along the way, the body absorbs or reabsorbs essential nutrients like glucose and amino acids and most of the water back into the bloodstream while secreting additional waste into the tubule. Finally, excretion, the final concentrated fluid called urine, is collected and sent to the bladder for disposal. Gross anatomy of the kidneys. Location. The kidneys are paired retroperitoneal organs located on the posterior abdominal wall between vertebral levels T12 and L3, so down below. The right kidney lies slightly lower than the left due to the liver being placed on top of it. Shape and dimensions. The kidneys are bean-shaped organs with length 1 or 11 to 12 centimeters, width 5 to 7, and thickness around 2.5 to 3 centimeters. Average weight 120 to 170 grams. Let's look at these external features within the picture. So you have the superior pole, which is the uppermost part of the kidney, the inferior pole or the lowest part, the medial border. The medial border is this one in the middle, and lateral border, which is to the side. The renal hilum, and this serves as the entry and exit point to different systems such as the lymphatics, the ureter, the nervous system, and renal and artery vein. Protective coverings of the kidneys. The kidneys are surrounded by 3 layers. First, fibrous renal capsule. This is the innermost layer, a tough, smooth, transparent sheet of dense connective tissue. It maintains the kidney's shape, protects it from trauma, and acts as a barrier against the spread of infections from surrounding regions. The perirenal fat in yellow or adipose capsule. This middle layer is a thick mass of fatty tissue. Its primary job is to act as a shock absorber to protect the kidney from physical blows and to help hold the organ firmly in place within the abdominal cavity. Finally, renal fascia, the outermost layer of the kidney. It's a thin shell of dense fibrous connective tissue. It effectively anchors the kidney and the surrounding fat to the posterior abdominal wall and the diaphragm. It ensures that the organs stay in their proper anatomical positions. Internal anatomy. Renal cortex. The cortex is the outer granular region containing renal corpuscle. This is the renal corpuscle with glomerulus and Bowman's capsule. It is the filter mainly located in the renal cortex. This is the starting point of the nephron. It consists of 2 parts, the glomerulus, which is a high pressure knot of capillaries, and the Bowman's capsule function. Its sole job is filtration. It acts like a sieve, allowing water and small solutes, waste, salts, nutrients to pass into the tubule while keeping large blood cells and proteins in the bloodstream. The proximal convoluted tubule, or PCT, which is also called the reclaimer. This is the long winding section immediately following the renal corpuscle. It is responsible for bulk reabsorption, most of the good substances such as sodium, amino acids that was accidentally filtered out. It's reclaimed and grabbed back. It reclaims nearly 100% of glucose, amino acids, along with 65% of water and sodium, returning them to the blood stream. Distal convoluted tubule, or DCT, also called the tuner. This segment comes after the loop of Henle and leads to the collecting duct. It handles fine-tuning and secretion. While the PCT does the bulk work, the DCT makes precise adjustments based on the body's current needs. It's highly sensitive to hormones like aldosterone and PTH. It helps regulate calcium levels and pumps out excess potassium or hydrogen ions, which contribute to acidity within the body in order to maintain the pH level. The renal medulla. The medulla is the inner region composed of renal pyramids. These are the cone-shaped structures within the kidneys that are the concentration machinery, so to speak, of urine. They eventually drop the urine into the renal pelvis, and they are connected to the lobe of Henle inwardly. So again, they are the distinctive cone-shaped tissues that give the renal medulla its striped appearance. The stripes are actually thousands of microscopic parallel running loops of Henle and collecting ducts. They act as the primary housing for urine concentrating machines, and the tip of each pyramid or the papilla are pointed inward, dripping the finished product, urine product, into the renal pelvis. Loop of Henle. This U-shaped section of the nephron dives deep into the renal pyramid and then climbs back out. The function, its main job, is to create the salt gradient in the surrounding tissue. The mechanism, as fluid moves through the loop, salt is pumped out into the medulla. This makes the area incredibly salty, which pulls water out of the nearby collecting ducts later on, ensuring you don't lose much fluid. So basically it uses salt as a fluid retention agent. Finally, collecting ducts. These are the final drainage pipes that receive fluid from several different nephrons. This is where the body decides exactly how much water to keep or to get rid of through the control of ADH, antidiuretic hormone. As the fluid passes through the salty environment created by the loops of Henle, the collecting ducts open or close their water channels, aquaporins in other words. If you are dehydrated, they open wide to suck water back into the body, leaving behind highly concentrated urine. In this picture, we see a clearer display and illustration of the concepts that were explained in the previous slide. So, starting from the renal pyramid, again, these are the cone-shaped like tissues that give the renal medulla its striped appearance. So the stripes are actually thousands of microscopic parallel running loops of Henle and collecting ducts. Main function is the main housing for urine, and their inward parts, or like the papilla, the top of the cone, runs inwardly and it is pointed toward the renal pelvis. Okay, it drips the final product into the renal pelvis. The loop of Henle, the U-shaped structure, main job is to create a salt gradient in the surrounding tissue. As the fluid moves through the loop, salt is pumped out into the medulla. This makes the area incredibly salty, which is necessary for pushing back the fluid into the body and ensuring, like, it's an insulation, ensuring you don't lose much fluid from the body into the final duct, okay, the final renal pelvis. Finally, the collecting ducts. It is the final drainage pipe for each nephron. This is where the body decides how much water needs to be retained and how much water needs to be pushed out of the body through the ADH, or the antidiuretic hormone. So as the fluid passes through the salty environment created by the loops of Henle, the collecting ducts would open or close their water channels. They are called aquaporins, and so if there's too much dehydration, they open wide to suck water back into the body, leaving behind a tightly concentrated urine. The renal pyramids, these are the conical structures that you see in red, whose apices or the apex are called renal papillae, which actually drops the drainage, the final drain, into the renal pelvis. The urine drains from papillae into minor calyces, major calyces, and renal pelvis. Let's talk about these three. The minor calyx, it is a small cup-shaped duct. There are typically 8 to 18 minor calyces in each kidney. Each one fits snugly around the renal papillae, the pointed tip of the renal pyramid. It is the first point where urine is collected after it leaves the collecting ducts. Once urine enters the minor calyx, its composition can no longer be changed. It is officially the final product. The major calyx, it is a larger conduit formed by the merging of several minor calyces. Each kidney usually has 2 to 3 major calyces, superior, middle, and inferior. They act as the primary branches of the central collection system, receiving urine from multiple pyramids and funneling it toward the center of the kidney. Finally, the renal pelvis. This is a large flat funnel-shaped cavity. It is formed by the convergence of all major calyces, and for the location it sits within the renal sinus and exits the kidney through the renal ileum. It serves as a central reservoir. As it exits the ileum, it tapers down to become the ureter, which can then carry the urine down to the bladder. Blood supply of the kidneys. The kidneys receive approximately 1.2 liters per minute as a blood flow. Arterial supply, blood flow pathway from renal artery to segmental arteries to interlobar arteries to arcuate arteries, all the way to interlobular arteries. Clinical correlation: reduced renal perfusion may lead to acute kidney injury, AKI, formerly known as acute renal failure, which is a sudden and often reversible episode of kidney failure or damage that occurs within a few hours or days. It is characterized by the kidney's abrupt inability to filter waste products from the blood, maintaining fluid balance and managing electrolytes. Unlike chronic kidney disease, CKD, which is permanent, AKI can often be reversed if the underlying cause is treated quickly. It affects approximately 1/5 hospitalized patients and is particularly prevalent in intensive care units or ICUs. For the common symptoms, while mild cases may show no symptoms, more severe AKIs can lead to decreased urine output, fluid buildup, causing swelling in the legs, ankles, or feet, or sometimes shortness of breath. Also confusion, fatigue or drowsiness, or nausea and chest pain or pressure. Hypertension, which is the elevated blood pressure due to the over-retention of fluids and a high concentration of sodium. This can build up the blood pressure. Finally, ischemic damage. The kidneys are uniquely vulnerable to ischemia because their high metabolic demand for oxygen, primarily for active transport in the tubules. Okay, ischemia is a shortage of delivery of oxygen and other nutrients to different organs of the body. So it must be met by a good supply that is heterogeneously distributed. While the renal cortex receives nearly 100% of renal blood flow, the medulla only receives 5 to 10%. This makes the tubules in the outer medulla particularly susceptible to even minor drops in perfusion. Cellular injury. Ischemia leads to rapid ATP depletion, adenosine triphosphate, mitochondrial dysfunction within the cells, and oxidative stress. This triggers ATN, or acute tubular necrosis, the death of the tubes, characterized by death of tubular epithelial cells. Reperfusion paradox. Paradoxically, the restoration of blood flow, reperfusion, can worsen damage by generating reactive oxygen species, ROS, and activating inflammatory pathways. The nephron. The nephron is the structural and functional unit of the kidney. Each kidney contains around 1 million nephrons. As for the components, we have the renal corpuscle, which is the entry point where blood is first filtered under high pressure. It consists of the glomerulus or capillary knot and Bowman's capsule, the cup-shaped capsule, which captures the resulting fluid. Proximal convoluted tubule or PCT, the major reclaimer that immediately reabsorbs about 65% of the water and 100% of vital nutrients like glucose and amino acids back into the bloodstream. Loop of Henle, a U-shaped tube that dives into the kidney's medulla to create a salt gradient. This setup is essential for the body's ability to concentrate urine and conserve water, for water retention basically. Then DCT, distal convoluted tubule or DCT, a fine tuner that uses hormones to precisely regulate levels of sodium, potassium, K+, and calcium, while also secreting acids to maintain proper blood pH levels. Collecting duct, the final drain where multiple nephrons empty. It performs the last stage of water regulation or reabsorption controlled by ADH, antidiuretic hormone, before sending the finished urine product back into the renal pelvis. The renal corpuscle, composed of glomerulus and Bowman's capsule, so we're reviewing these parts that we've already discussed. The glomerulus, which is the high pressure filter, is a microscopic ball-shaped cluster of specialized capillaries. Unlike most capillary beds that transition into veins, the glomerulus is nestled between two arterioles, afferent and efferent. The pressure engine, because the efferent arteriole exit is narrower than the afferent arteriole, which is the entrance, it creates a high pressure environment within the cluster. The sieve, this pressure forces water and small solutes like salts, glucose, and urea out through the leaky capillary walls. Selective barrier, large components such as red blood cells and most proteins are too big to fit in, to pass through, and remain within the bloodstream. In this picture here, we see the glomerulus, which is the capillaries bundled together in the shape of a sphere, and this is the Bowman's capsule. The Bowman's capsule is the collection cup, so to speak. It is a double-walled, cup-shaped structure that completely surrounds the glomerulus. The inner layer, or the visceral, this layer is made of specialized cells called podocytes. These have long finger-like projections that wrap around the glomerular capillaries, forming narrow filtration slits that act as a final tuning filter. The outer layer, or the parietal, this is a simple epithelial layer that forms the outer boundary of the cup. Then you have the capsular space, which is the one in a homogeneous brown-like color. This is the hollow space between these two layers that captures the fluid forced out of the glomerulus. This fluid is now called the filtrate or primitive urine, and is funneled directly into the proximal convoluted tubule or PCT to begin the next stage of processing. 3. Physiology of urine formation. Urine formation is the process by which the kidneys filter blood, remove waste, and maintain homeostasis. 3 major physiological processes are involved, such as glomerular filtration, tubular reabsorption, and tubular secretion. Glomerular filtration occurs in the renal corpuscle. Blood pressure forces plasma through the filtration membrane, and filtered substances include water, glucose, electrolytes, and urea. Large proteins and blood cells normally remain in circulation. As a reminder, the renal corpuscle is the glomerulus along with the Bowman's cup. Together they form the renal corpuscle. GFR, or glomerular filtration rate. Normal GFR is between 90 to 120 milliliters per minute. GFR is an important indicator of renal function. Tubular reabsorption, useful substances are returned back to the bloodstream. Reabsorbed substances would include glucose, amino acids, sodium, water, and approximately this is 99% of return. Tubular secretion, additional wastes are secreted into tubular fluid. The secreted substances would be hydrogen ions that increase the blood acidity level, potassium, which is an inhibitory substance that reduces heart rate, and an excess of that substance may lead to a cardiac arrest, drugs, medication and other things, and also toxins. Important for acid balance or acid-base balance, and also toxin elimination. Very important. Formation of final urine. Final urine contains water. Excess water needs to be pumped out of the body because an excessive water level would increase the blood pressure. Urea, which is the waste from food and other things that are disposed by the urine, by the urinary system through the urine. Creatinine, which is the waste from muscular activity, and electrolytes, or the charged particles that trigger heart contraction and other muscular contraction, also fluid retention within the body, and the nervous system signal transmission. Average daily urine output is to 1 to 2 liters per day. More about creatinine. So it is again a chemical byproduct of muscle metabolism produced during the normal breakdown of creatine phosphate in your muscles. It depends on the muscle mass, typically produced at a very steady rate. It is considered to be a better indicator of kidney health more than urea. Urea and bun. Urea is a waste product generated during protein metabolism. When your body breaks down protein from food or from your tissues, the liver needs to produce urea as a way to get rid from nitrogen, to dispose nitrogen from the body. Bun versus urea. This is typically measured as blood urea nitrogen, BUN, which specifically quantifies nitrogen portion in the urea molecules. Unlike creatinine, it can fluctuate, so during two different reasons. That's why the creatinine is a better, more accurate factor indicating the health of the kidneys. Other factors affecting the urea concentration would be a high protein diet or certain medications. 4. Fluid, electrolyte, and acid-base balance. The kidneys regulate total body water. Water intake must equal water output. Regulation by ADH or antidiuretic hormone. ADH increases water reabsorption in collecting ducts. Increased ADH would lead to concentrated urine. Meanwhile, decreased ADH leads to diluted urine and an excess of water within the urine. Higher water concentration. So how is water level regulated within the body? First, ADH or antidiuretic hormone, also called vasopressin. It is the body's primary water-saving hormone, released by the posterior pituitary gland within the brain when the blood becomes too concentrated, high osmolarity, or the blood volume is low. The target is the collecting ducts within the kidneys, and the distal convoluted tubules or DCT triggers the insertion of water channels called aquaporins into the tube walls. So the water is reabsorbed back into the blood, making urine more concentrated and increasing the blood volume, also the blood pressure. Angiotensin II, this is a powerful hormone activated when the kidneys sense low blood pressure or low sodium. So it causes systemic vasoconstriction, the constriction of the blood vessels, the narrowing, which leads to a raise in the blood pressure. It acts as a master switch that stimulates the release of both aldosterone and ADH. This increases blood pressure and leads to water retention, fluid retention. Finally, aldosterone, which is called the salt-retaining hormone, released from adrenal cortex in response to angiotensin II. It forces the kidneys to reabsorb sodium Na+, while releasing potassium K+. Potassium leads to a reduction in the heart rate, a lowering of the heart pressure. So, since water follows salt, the reabsorbed sodium pulls water with it into the bloodstream, increasing the blood volume and pressure. Electrolyte balance, sodium regulation. Sodium controls blood volume and blood pressure, regulated mainly by aldosterone. Potassium regulation, kidneys maintain serum potassium levels. Hyperkalemia may cause cardiac arrhythmias, an irregular heart rate. Acid-base balance, normal blood pH is between 7.35 to 7.45, which is almost neutral. Kidneys regulate pH by secreting hydrogen ions, which elevate the acidity level of the blood, or reabsorbing bicarbonate to reduce the acidity and increase the pH level to make it more alkaline. Acidosis, which is a low blood pH level around 7.35 and lower, actually lower below 7.35. Alkalosis, which is a high base level blood pH above 7.45. Urine transport. Urine travels from kidneys to ureters to the bladder, which is temporary container or reservoir for the urine, all the way to the urethra, which is the lower interface leading the excretion of the urine outside of the body. The urinary bladder functions as a temporary storage for urine and for controlled elimination. Micturition reflex. It means urination. The reflex involves stretch receptors, spinal cord reflexes, and voluntary control. Composition of urine. Normal urine contains around 95% of water, urea, electrolytes, and creatinine. Normal urine does not contain glucose, blood, or protein. 6 diseases and disorders of the urinary system. Urinary tract infection or UTI, usually caused by bacteria such as dysuria, frequency, and fever. Dysuria is the medical term for pain, discomfort, and a burning sensation during urination. It is a common symptom rather than a disease itself, and typically points to a tissue within the urinary tract or the surrounding genital area. Kidney stones, solid crystal formations in urinary tract. Risk factors: dehydration, hypercalcemia. Dehydration is the lack of water within the body, or dryness. Hypercalcemia, which is a medical condition characterized by abnormally high levels of calcium in the blood, generally defined by a total serum calcium concentration exceeding 10.4 or 10.5 milligrams per deciliter. And diet. Symptoms: severe flank pain and hematuria. Severe flank pain and hematuria are significant clinical symptoms that often signal an underlying disorder of the urinary tract. When these symptoms occur together, they typically indicate a condition affecting the kidneys or ureters. Hematuria, the medical term for blood in the urine, it is classified as gross microscopic hematuria, blood that is visible to the naked eye, turning urine pink, red, or cola colored. Microscopic hematuria, blood detected only under a microscope during a urinary test. Acute kidney injury or AKI, sudden decline in kidney function. Causes: shock, toxins, concentration, and severe dehydration. Chronic shock means a sudden malfunction in the kidneys or a related organ. Chronic kidney disease or CKD, progressive irreversible loss of kidney function. Common causes: diabetes mellitus and hypertension or high blood pressure. Dialysis, artificial removal of waste products types hemodialysis and peritoneal dialysis. Urine analysis examines urine characteristics such as color, pH level, which determines acidity, protein concentration, or the presence of proteins within the urine, or glucose or blood. Blood tests: serum creatinine, marker of kidney function. Blood urea nitrogen or BUN measures nitrogen waste in the blood. Imaging studies: common imaging, ultrasound, CT scan, and MRI. These are used to detect stones, tumors, or obstruction within the canals, like the renal pelvis, for example. Cystoscopy, endoscopic examination of bladder and urethra. Kidney biopsy, removal of renal tissue for microscopic examination. Indications: glomerular disease or unexplained renal failure. 8. Maintaining urinary health. Hydration. Adequate hydration prevents stones, supports filtration, and reduces infection risk. Recommended intake: 2 to 3 liters per day. Nutrition and kidney health. Healthy diet recommendations: low sodium intake, balanced protein intake, and reduced processed foods. Lifestyle factors: important preventative measures would be regular exercise, smoking cessation, blood pressure control, and diabetes management, which means a lesser intake of sugar. Prevention of UTIs, preventive measures: this would be proper hygiene, adequate hydration, and regular urination. Effects of diabetes and hypertension. Diabetes mellitus can damage glomerular blood vessels and leading to diabetic nephropathy. Diabetic nephropathy, also known as diabetic kidney disease, DKD, is a serious progressive complication that occurs when long-term high blood sugar levels from diabetes damages the kidney's delicate filtering systems. It is leading the causes of kidney failures globally. Each kidney contains about 1 million microscopic filtering units called the nephrons. Capillary damage over time, elevated glucose levels, poison and damage the tiny blood vessels or capillaries within these filters, known as glomeruli. As these filters become scarred and leaky, a protein called albumin begins to pass out of the blood and into the urine, which is often the first measurable sign of the disease. Continued damage leads to the buildup of waste products in the blood, eventually progressing through 5 defined stages toward total kidney failure. Early signs and symptoms. At its early stages, it would be silent. There would be no obvious symptoms that the disease is there to begin with. But then, as it advances, it leads to other symptoms such as edema, which is the swelling in the ankles, feet, hands, or around the eyes due to a high retention of fluid levels, and changes in urination, needing to urinate more frequently than usual, systemic fatigue, feeling persistently tired, weak, or having trouble focusing, and gastrointestinal issues such as nausea, vomiting, and a metallic taste in the mouth. Hypertension, chronic high blood pressure damages renal vasculature, major cause of CKD. Finally, maintaining urinary health requires proper hydration, healthy diet, blood pressure control, early disease detection. Preventive medicine significantly reduces the burden of renal disease. At the end, thank you for watching and see you next time. As a clear disclaimer, this presentation is never meant as an alternative to seeing the doctor. It's only for educational purposes with no guarantees for accuracy, medical accuracy, so to speak. Okay? It's only meant for education and not for therapy or a clinical alternative than to see a doctor when you have a problem. So it's not meant as a guide for medicine, but rather an informative resource. God bless you and bye-bye.